Consider this, a program of issues and information behind today's news.
Hey, hurry, he's bleeding bad. He's right over there, tractor fell over. Got too close to the edge and went right over on him. Bent both his legs.
Yeah, is there any way we can get that tractor off?
Well, you might be able to use this truck with ground swath.
Tell you in a minute. No, there's no way we're gonna bring that truck out here.
It's my fault, I guess.
How'd you figure?
Oh, I don't mean about the tractor. I mean about me not looking for him sooner. I guess that's the end of my job, you know. It's a tough boss.
There's no way we're gonna get that squad up here.
Couldn't get a doc for you, Mr. Hammond. They sent these guys instead.
Is he hurt anywhere but his arms? What about his legs?
No, I think they're okay. Dirt's pretty loose under there.
Do you feel any pain anywhere?
It's not very good. Blood pressure, 88/42. He's gonna need ringers fast.
We don't really think about them until we need them, a need that reaches across the state, especially in the rural areas. Hi everyone, I'm Kathy Wyatt. Welcome to this week's edition of Consider This. Our topic, emergency responders. Joining us to talk more about it are Dr. Eric Ernest, Assistant Professor in the Department of Emergency Medicine at UNMC, Medical Director for the Bellevue Fire Department, Sarpy County Dispatch, and Cass County EMA, and Assistant Medical Director for the Omaha Fire Department and Creighton EMS Education. Next to him, Chad Cordy, a paramedic for Cass County EMA, and finally Jacob Blunt, a volunteer for Elmwood Rescue in Cass County. Thanks to all of you for being here. Welcome.
Thanks for having us.
Thank you.
All right, Dr. Ernest, I'm going to start with you. We have 430 licensed ambulance services across the state, right?
That's correct.
So let's start by talking about what does it mean to be licensed?
So the licensing process starts off with a group that wants to provide emergency medical services to their local community. Usually this is at the governmental level of a city or town or municipality, and they have certain rules and regulations that they need to abide by and certain equipment standards. They make an application to the state to grant them a license to provide emergency medical services to a certain area.
Okay, so when we're talking about 430, paint a picture in terms of coverage here in Nebraska.
Sure. So there's two basic types of ambulance services. There's a ALS, which is Advanced Life Support, and then also a BLS model. The ALS allows them to do more procedures and skills and are trained at a little bit higher level than the basic level provider. In terms of numbers, it's varying depending on what part of the state you're in, but especially in the more rural counties, a lot of those services are of the basic life support variety. Often staffed with a volunteer fire department.
Okay. And for those who aren't as familiar with rural Nebraska, right? Paint a picture of the day-to-day in those areas.
Sure. So oftentimes in those areas, it's a local community, and from an emergency standpoint, like I said, the volunteer fire department will often provide coverage for their citizens. Often these volunteer firefighters will be out working in the community doing other jobs or tasks, and that when a need arises or an emergency arises, that they are paged or toned out, and that they go and respond to their own community.
So when we're talking about needs or emergencies, what are some of the more common things that you deal with, and maybe even the not so common things we might not even think about?
Sure. So common emergencies that often happen or that EMS is called for include respiratory emergencies, things like difficulty breathing or problems with asthma, also heart-related issues like heart attacks. Then some of the not so common things could be major trauma or a pediatric case of a child that's sick, all of which require an emergency medical care.
Okay, and typically who responds to those calls in the rural areas, and what are the outcomes?
Sure. So as I said, the volunteer fire department usually in the rural areas, will be the first ones to respond. The vast majority of those will be a basic level life support provider. And then they will do the best to stabilize the patient and usually transport them to a local hospital, which sometimes, depending on the county, could be quite a distance away from where the original call was from.
Yeah, which is a good segue into what's happening is good, but it could be better.
Sure.
And this is where your area of expertise comes into play. So before we get to the next question, tell us a little bit about you and
Sure,
your background
sure.
and how you became involved in all of this.
So I originally trained as a paramedic, went to school locally here at with Creighton EMS, and continued my development. Worked as a paramedic for several years, and then went on and went to medical school, did some training in emergency medicine, then actually did a subspecialty training year in St. Paul, Minnesota, which is a subspecialty in EMS, and then came back to the University of Nebraska to help build up and really foster a vibrant EMS community.
So what are some of the things that you have done up to this point then?
Sure. So providing medical direction is my primary responsibility, so that means physician oversight of the individual EMS agencies. Duties can include forming or writing protocols, ensuring good quality within the system, performing quality assurance measures, teaching and educating our providers. So all the combination of all those things is really what the medical director is doing.
And the favorite part, because you really do have a lot of titles, doctor. So
Yes.
what gets you up in the morning and gets you going? What's the favorite?
I think it's just getting out and being with the crews. One of my favorite things to do is actually go out and ride with them. I'll jump on an ambulance or in a response vehicle and actually go out and respond in the field with them from time to time. And kind of getting back to my paramedic days, that's my favorite part.
Which is advantageous, really. I mean, when you're the guy who's helping develop all of this stuff, it's good that you're keeping your finger on the pulse of what's really happening, correct?
Yes.
Okay, so we talked about good being better. You painted a nice picture of us, for us, of the rural communities. So how do we go from being good to being better? What have you done recently here?
So what's been going on with Cass County is that there was a need that was identified by the Cass County Commissioners, that a study was performed of Cass County to look at their EMS coverage, especially during the daytime hours, where a lot of people will leave the county to go do other jobs, or they may have other responsibilities. And when those people leave the county, that leaves less people to be able to respond to local emergencies. So the Cass County Commissioners had the study performed on the county, realized that the coverage was lacking. And so really they wanted to find a system that could put people in the county to be able to respond to emergencies, especially during the daytime hours. Coupled with that was the idea of advancing the level of care in the county, and that's when they decided to hire on 2 paramedics, which again are the advanced life support type providers, which they have advanced skill sets, they usually have more training, and so really elevating the level of care in the county as a whole.
Why now? I mean, because we've had obviously emergencies for quite
Yes.
some time. There's been a need for
Right.
quite some time. So what was it in Cass County that got those commissioners to thinking, you know what, this is the time. This is
Yeah.
when we need to be doing something.
I think really, I mean, as communities develop and as people have jobs and responsibilities outside of their hometown, and as people move out of the rural setting, the ability to cover and respond to those local emergencies is becoming less and less. And realizing that the state of pre-hospital medicine has really grown by leaps and bounds, even in the past few years. The things that we're able to do in the field are so much more advanced than what they were 10 to 15 years ago. Coupled with that is that Cass County does not have a hospital within its borders. So the patient who has a heart attack or a stroke or other things that require a higher level of care, we can now provide that care in the county before they reach definitive care of a hospital.
Wow, all very exciting news, Chad, for someone like you. To think that your county, right, is the first one to really undergo this special partnership. So January 1st was a pretty big day, but before we get to that, tell us a little bit about your agency, your organization.
I work for Cass County Emergency Management, and they have developed a division of EMS underneath them, which we are coupled with a EMT generally from the county, but we also work with EMTs from other places. And we are in a fly car that goes and assists all of the services that function in Cass County.
You were in a
Fly car, or it's just basically a pickup. We have all the supplies that we need in our pickup, but they basically refer to it as a fly car, and we just go. We don't do any of the transporting. We're a non-transporting agency. We just assist the BLS agencies with ALS care.
Okay, and how long have you been doing what you're doing?
I've been in EMS since about '99. Been a paramedic since about 2002.
Okay, so when Dr. Ernest talks about changes, and we have them in every industry, right? What are some of the biggest ones that you have seen that would bring us up to what we're discussing today?
One of the reasons, I guess, that the need for this is the retention and the recruitment throughout the state of Nebraska. You've got your older EMTs that are on, and to find the younger people to come on and do it sometimes is getting harder and harder to do. So they're having a harder time trying to staff their ambulances and fire departments and things like that on a volunteer level.
Well, that's a great point to bring up. So the next question then becomes, what are you doing to actively recruit? I mean, for people who are watching, you know, we all have our ideas about what you folks do on a day-to-day basis, but what does it really take to be a good, right, a good individual, a good professional in this industry?
I think that all of the services that function in Cass County are excellent services, and to add the ALS portion to it, like Dr. Ernst hit, where they don't have hospitals and stuff, takes it to that next level to where it's really providing great care to all the residents of Cass County. And it's a great thing that the county commissioners have done for that. As far as the recruitment and stuff, you know, I can't speak from their point of view of what they do to recruit their people.
I have to ask you, because we hear great care, quality care, awesome care quite a bit. How do you define great care, Chad?
I would say most of it is based on your patient outcome. As long as your patient has a great outcome from the care that you've provided, then you have established a great quality of care. And like I said before, the squads that are in place already in Cass County prior to us were delivering the best care, better care than some of the other places, just because they're at a more advanced level. But to bring a paramedic into it and introduce the medications and everything else that we can do definitely takes it to a whole different level.
We'll talk about training in just a minute, but I'm curious, and I know others are too, when you're not responding to calls, right, what are you doing?
We are, for one, we're fairly new starting up, so there's a lot of things to do. Just mapping out the county, trying to figure out where the quickest route to each call would be, doing the training with the other departments to learn how they like to set up on a scene and how they function, learning their ways, and then also training the EMTs that are working with us so they understand how we like to function and the things that we like to do. And so we can kind of stay a step ahead of one another.
Okay, people like the gentleman to your right, helping him
Correct.
stay a step ahead. So this is Jacob, and you are a volunteer, right?
Yep.
So talk to us a little bit about life outside of this realm, and then how you got into doing what you're doing as a volunteer for Cass County.
Well, I've really been around it my whole life. My dad, he's the rescue captain in Elmwood, and he has been an EMT for 40 years now. And so I was kind of just born into it, you could say. My sister, my brother-in-law, my oldest brother, he's also a paramedic with Omaha. So I've kind of just grown up around it, and it's always been something I've enjoyed doing. Because when Dad always came home, he always told stories before all the HIPAA laws and everything came into effect. And just kind of like his drive kind of pushed me into it, and his dedication. And I've just kind of grown off of that, and I just enjoy giving back to my community. And then when this program started up in Cass County, we were gung-ho. We were all for it. We're like, yeah, we need to get the ball rolling on this, because during the daytime it is tough, because I also work a full-time job.
Yeah.
And when the patient knows that people are coming, it kind of gives them a sense of hope that there's someone coming to help me.
Jacob, what do you do full time?
I'm actually a dispatcher with the Nebraska State Patrol out of Lincoln. So I dispatch for the troopers and answer their calls and everything else. So I'm still involved in the emergency services field.
You couldn't get enough of that full time.
No.
You had to branch out, right?
Yep.
Now, is Chad partly responsible for recruiting you as the volunteer? Is that more family stuff? Because I know he recruited you for this program.
Yeah.
Right? So
Yes, he did. Yes, he did. I actually know Sandy Wires, the director down there, and when this program was starting up, I felt like, you know what, this is a good way to get out and meet the other members of the squads in Cass County. I mean, we're on the west side of the county, and we don't hardly ever go over to like Murray, Union, Nahaka, because that's a 20-25 minute drive for us if we took an ambulance or fire trucks over there if we're on a call. So this was kind of a good way to branch out and meet the other EMTs and volunteers and just commingle with them and kind of learn what they do, because some people find easier ways to take blood pressures or lung sounds or just different ways, different techniques. And with me being a new EMT, I've had my EMT license for going on 2 years now, so I'm still learning. I mean, I'll probably be learning for the rest of my career, but it's always another tool in your toolbox, essentially, to use it on future calls.
Okay, let's talk a little bit, gentlemen, about training, because what you do is so imperative, so critical. And one of you said that people, they're waiting for you to get there to help them. So what type of training are we talking about? Chad, I'll start with you in terms of what does it take to be successful and effective and provide that great care that you mentioned earlier?
You obviously have to go through the EMT and then the paramedic course. You have to have a prerequisite EMT before you can become a paramedic. All those encompassed together, you're looking at probably 2 to 3 years just in classroom time. You've also got to do your clinical time, which is in the hospitals and surgery suites, and then your field care also. And then for us, it never really stops. I mean, we're always training, we're always going to different conferences, or we're training with Dr. Ernst on the newest techniques to have better outcomes for all of our patients that we come into contact with.
Okay, and Jacob, what about you? What did it take for you to get involved here? And was there one part of it that was more challenging than another, where you thought, okay, that's enough and I'm not going to be able to do this, right?
Well, you do have some calls that you go on that you're just like, is this really what I want to do? Do I really want to experience this occasionally?
Like what, Jacob? Like what kind of call would that be?
I've been on some pretty horrific car accidents that, with knowing the people in the vehicle too, that's probably been some of my harder calls that I've been on. When the pager goes off and it says something about a child or an infant, your senses kind of heighten, and your drive is a lot harder to get there, because you've been through that stage in life, and you just want to help those people get through that stage in life and provide the best care that you can.
Okay, so from a training standpoint then, Doctor, how do you prepare people for that? I mean, he's talking about people that he knows, and there has to be a point where you have that compassion, but you have to separate, right? So how do you train somebody to be able to do that effectively?
It's difficult, and giving them the tools and the resources to, provide the medical care and the medical side of things. But to teach a dissociation or a not getting too emotionally involved, that can be difficult, especially in the volunteer fire community, where a lot of these small towns, you do know the person in the car or the person having the heart attack, because they may be your next door neighbor. And I can only imagine that those are very difficult situations for some of those providers. Whereas in a large metropolitan system, much like Omaha, there's a lot more distance and separation, and you probably aren't going to know the person that you're pulling out of that car wreck or helping them with their heart attack.
It's got to be pretty hard, Chad, I would think, to have someone with whom you've been working, right, run across something like that and then just say, I'm done. I can't do this anymore. And then you're the one trying to convince them maybe that they are the person, right? And we lose them anyway.
Yeah, I can't say that I've ever personally been put in that situation. There's been several calls that I've questioned my own, of whether I want to keep going. And to hit up on like what Jacob said, pediatrics are definitely the toughest. I've got 6 kids at home, and so running up against any pediatric calls, nobody likes to run them, nobody likes to deal with them, but obviously we're the professionals here, so we've still got to maintain and make sure that we're providing the care that is needed at that time. And afterwards, we just kind of usually we'll talk with someone or deal with it in our own ways.
Yeah, Jacob, he's painting a picture here. We're talking about the kids, and that's challenging enough. But then you have all the dynamics going on around this emergency situation, right? So it's not just the patient you're dealing with. It's the family member, the friends, depending on whatever the scene is that you're encountering. And you never really know, right, what you're coming upon until you get there. So are you able then, Jacob, when you arrive to separate that, to really focus on the patient and let the rest of it go? Or how is it that you're able to take family members and separate that?
Well, normally when we come on stuff like that, we normally have law enforcement there who can also help with taking care of the family, because this could possibly be one of their worst days that they've experienced, especially when it comes to pediatric calls. And like touching on what Chad said, I got a niece and a nephew, 5 and 6. So going to calls like that can be disturbing. But from the training aspect, when you're training and you're constantly training, when that pager goes off, your mind kind of kicks into a different gear where it reverts back to your training that's been you hit on for the last 6 to 8 months of your EMT class, and then you're just in a kind of a different mindset, and you revert back to all your skills that you learned.
So let me ask you, Jacob, for anybody watching who might be interested in pursuing something like this, working their full-time job and then maybe taking this as a volunteer opportunity, what would you tell them if they were here in the room in terms of what to expect and encouraging and so forth?
Well, I would definitely go talk to your local fire department, rescue squad members. They can paint you a picture of what goes on. Talk to them. Ask them about how they handle some certain calls. Sign up, like Elmwood, we do a ride-along program, so you can sign up and you can be in the back to understand what we do. And then normally about that time, we're also trying to provoke you to go take your EMT class, just to give you kind of some first hands-on experience. And that's what I really kind of push to people, is like, hey, give this a try. If you don't like it, it's no harm, no foul.
At least you tried.
Yeah, at least
right.
you've experienced kind of what we go through, so now you kind of have the mindset of what we do when the pager goes off.
Chad, what's the most misunderstood thing about your world, do you think, for those of us on the outside looking in? What aren't we quite grasping that might be good for us to grasp from where you sit?
I think a lot of the general population believe that we show up, throw you in the truck, and drive as fast as we can to the hospital to get you there, to get you the help that you need, and don't actually understand that the help starts the moment we hit the door. We've actually had the training that we can perform a lot of the procedures and give a lot of the medications that you're going to receive once you get to the emergency room anyways. So instead of waiting for that in Cass County's aspect, waiting 30 minutes to drive to the emergency room, you get it immediately as soon as we show up to the door. And they say that time is tissue in a lot of circumstances for heart attacks and strokes and things like that. If we can reverse or at least stop the damage, we've helped them progress and live a better life later on down the road once they've taken care of blood clots or whatever is going on with them.
One of the things that I want to ask the two of you who are in this day to day, what can we as citizens do to help prepare for the unexpected and make your jobs arriving at any scene more bearable? Does that make sense, right? So that
Sure.
proactive mindset, what could we all be doing?
A lot of the times, just having a plan, I guess. You know, your medication's written out, so if you can't tell us what you're taking, I can see what those are. Also with your allergies, so I don't want to give you the wrong medication, but if you can't speak to me and there's nobody else there, at least I can see a list that's on the refrigerator, or they have a vial of life, which you would have in the refrigerator, that we could look at and at least find out those things.
Remaining calm is a huge one. It all starts from when you call 911 to when the dispatcher tones it out to when we go en route. Remaining calm calms the dispatcher and it calms us. And then when we show up on scene, we're in that mindset of, okay, the scene is, we're calm, the scene is safe, we can do our job a lot more effective instead of having people frantic, running around. And it works everyone up and everyone gets excited, and then we could overlook things.
Okay. Good information in the minute that we have. What's next with this Cass County adventure, right?
So we hope to expand. We hope to hire more people as time goes on. We'd like to eventually have 24-hour coverage within Cass County to provide that advanced life support for 24 hours a day. And then other special projects such as things like community paramedicine, where our paramedics are going out and in a non-emergent fashion helping the citizens of the county with some basic medical needs and trying to keep them out of the hospital and keep them from having to use the 911 service.
I got to tell you, this sounds like a phenomenal example of partnering, right, with organizations. UNMC, Cass County, fantastic. Keep up the great work. We want to put up a couple of websites for folks in case they want more information on what we've been talking about today. There's nema.ne.gov, there's FEMA.gov, and ready.gov. Gentlemen, thank you so much for being here to share your time and your expertise, and thanks for the community service that you do on a day-to-day basis. On behalf of everybody watching, thank you for everything that you do.
Thank
you.
You bet. And thank you all for watching. We'll see you next week.
Consider This is an issues and information program produced by UNO Television. More information can be found at unotv.unomaha.edu. If you'd like to share your comments about this show, call UNO TV at 402-554-2516 during regular business hours, or email us at considerthis@tvmail.unomaha.edu.